A very good afternoon to everyone present over here. It's indeed our privilege to welcome you all to this webinar on navigating social impact assessment, understanding the approach and implementation. And for taking this webinar, we have a very eminent personality with us, Dr. Anita Rego. I'll just give you a brief about ma'am. She's a distinguished leadership development expert with over 30 years plus experience in social development and social impact assessment. She's a founder and CEO of Pearl LSS 4 Development Private Limited, a social enterprise dedicated to providing a range of service in social impact assessment, corporate social responsibility, and NGO effectiveness. She has also been incubated at prominent institutions such as CIE, IIT Hyderabad, Apple, NASCOM, and Vadvani Foundation. Dr. Rego is a certified social impact assessor and she has conducted over 25 evaluations and hundreds of training programs. She is also a founder of Amida Care, a physiotherapy space, psychotherapy space offering mental health service. She holds a PhD and an MPhil in psychiatric social work from NIMHANS Bangalore and a postgraduate diploma in business management from MIGA. As a faculty of TIS, Mumbai and Hyderabad, she has worked with central and state government projects, NGO, and many international organizations, which includes Bill Gates Foundation and London School of Economics. Thank you so much, ma'am, for accepting our invitation for this webinar, and over to you. Thank you.
Thank you so much, Shruti, and it's my pleasure to be part of this workshop. To start with the whole thing, just let me do the screen share. Are you able to see the screen?
We can see it, ma'am. Yeah.
Huh? Okay.
We can see it.
Yeah, okay. Thank you so much. Yeah, today we are going to discuss about social impact assessment, an area which has recently received a lot of attention, even though we have been doing it from quite some time. So we all know that India is seeing a very promising future, and we have McKinsey report which says that India is likely to receive has received $4.2 billion since 2015. And it is going to only increase in the years to come. And this, if you really look at it, Niti Aayog says that the social sectors receives a 13% as much as the GDP. And the impact in investing can reach up to $6 to $8 billion by 2025. We know that with so much of investment that is going to come in, people at the investment side are going to be wanting to know what is happening to their money. So the interest of the ones that who want to enter the social enterprise space have an intent to contribute to the positive social, economic, and environmental impact. And when they contribute, they want it to be measurable and see that whatever they get have social returns. As we see on the right-hand side, you have different ways in which funds have been considered to be flowing in. This is a OECD framework, and the framework really describes on how the developmental finance will flow from different ways and how the strategy and the management approach, the transparency and governance become very important part of the whole system. And there's also a very important component in terms of how do you measure it and how do you disclose it. India has adopted the UN 2030 agenda and the Addis Ababa action agenda, which ascertains the importance of social impact assessment. And so that investment actually works on the SDGs and as well as ratifies the 2030 agenda. Now, where has now started the whole concept of social audit, now which is referred as social impact assessment. And this came in with the SEBI LODR regulation, which you are all aware of. And this regulation mandates that there is an independent scrutiny of the social impact of the social enterprises, wherein they have detailed out on what are the elements that need to be captured. So all enterprises which have raised money through the SSE or have just registered are mandated to fill in the annual impact report. The annual impact report will be assessed by a social impact assessment firm, and that firm will have employer social audit impact assessor. And this has to be filled in by 90 days from the conclusion of the financial year. This year, there have been a extension that has been given. Now, if you look at social impact assessment, there are four important reasons why people do it. One is that you have to evaluate whether there is an impact that has happened based on what has been the thesis that has been put by the theory of change and the commitments that are made by the non-profit organization. It also helps us to forecast what can be the impact, because if you're doing it in the initial phase of the project, or if you want to get into the extension, you can make a forecast for it. You can actually plan out how your investment can be really planned for the next few years that you want to consider, and also monitor the impact on an ongoing basis. So if you look at the whole process, you will see that we establish what is a mandate and the investment thesis, then move into what should be the metrics that we want to develop the measurement framework, track and manage the whole thing, and then you get into the evaluation as we have laid down in the protocols. This impact evaluation that we intend to do has different users. The users can be the ones who are the investors. It can be the social enterprise by itself. It can include the investment managers who are there, or it might be the third-party organization or the policy makers who would be watching and observing what is happening in the space. And in case they want to expand or replicate these interventions that have been put forward, it'll probably give them an understanding on how to go forward. Now, while impact assessment has been happening with the CSRs and other NGO interventions, the question that comes to our mind is that, are we measuring the things right? And to what end are we really measuring? Once we are measuring, are we really measuring and managing the things right? Are we using the data for managing the things right? And finally, how are we systematically integrating what we have learned from the impact assessment to make decisions for the future so that we have a positive impact? So, in some essence, it helps us to govern the whole project more effectively for whatever investment has been made. It also helps the non-profit to be accountable to the investor. It also increases the morale of the employees, because at the end of the day, the employees have to see that they are doing some change and that change is effective, so that they are able to hold on and feel good about themselves. Also look at what should be the future growth for the program. Recognize who are our supporters, how do you inspire the supporters, and how do you really show that the grant has really made a change. A lot of organizations may be desiring to do the impact assessment, but however, they struggle because a lot of donors don't provide sufficient funds to do the evaluation assessment in the way that they would like to do. They might not know what is impact measurement and what is impact management. They don't know, they may or may not know the differences between the two. They may not have the manpower to do the whole thing. They may not know how to set the goals, the theory of change, and the logic framework for analysis, or they may not have the right tools such as SROI or outcome mapping. And many of the organizations, they think that their job is only to implement and not to evaluate. So if you have to look at, having learned why people don't do social impact assessment, it's important that we get a commitment from the organization. And for us, if you are on the social stock exchange, then there is a mandate that is there. If you're not on the, if you're on the CSR, there is a mandate. But if you're getting funds from elsewhere, there may or may not be a commitment. And how do you, and once they have a commitment, they have to understand the process, put everything that is there in order so that they know what is the documents that they have to do. They will have to put in whatever they have to this, and they have to collaborate and close the loop. Now, when we say about impact measurement, we need to understand what is the difference between managing and measuring. When we say impact management, is that we are trying to put in the money so that we have some goals that we have decided on, and that is to reduce the negative impacts that are there and increase positive ones. So this requires both the support of the investor as well as the social enterprise, so that they bring in positive impact and reduce the negative impact through decision making, investment, the strategies that they have, and through the whole process that goes in from the investment till the whole exit of the program. In measurement, that is your actual program management that we do. Now, when we say measurement, measurement is primarily a segment of the whole process. And that process, in that process, we are just measuring and monitoring what is the change that we have brought in, either in societal change, or it can be environmental change. And this change has been brought about by the activities that has been given through the investment that has been put into the program. And to do that, you might have certain principles that we need to follow from the evaluation frameworks. You might have certain methodologies. You might have to use certain standards so that the whole process becomes very robust and we are able to measure both positive and negative outcomes. So now most projects have a certain log frame that they have developed. We are a little robust organization. And in that log frame, you have the overall objectives, the what is the purpose of the project, which is your aim and objectives. And you would have listed out what is it that we expect at the end of the period of the funding. And during, to make that happen, there would be certain activities that are listed out, and what is the process that you need to follow, the means that you need to follow. And it would also have an understanding on what is the problem situation. So once we have that, we get into the evaluation criteria. These are the OECD criteria that I have looked at. Here, what they look at is that the objective and the purpose. Like suppose, say I have an objective that I have to get all the children in school. And the purpose is that we reduce the dropout of children at the school level. So what is the overall impact that we are going to get? The overall impact is that we will improve the literacy of the community. Now, when we look at whether if we have to improve the literacy, we may not know whether everybody is literate, because the impact will not, very difficult to measure. It's like saying that we don't know whether HIV has been reduced or maternal mortality has reduced until we study the whole of the country, correct? That is the impact measure. Now, but we know that this program has been effective because in that small segment that you have done, in that segment, you know the strategy is working. We are able to get an effective response in the community because people are coming to the hospital, they are taking services, they are for taking the medications that they have been asked to take. So we know it has been effective. But has it given the results? That's where your efficiency comes in. How do you know that efficiency is there? We'll say that in this village, the maternal mortality has come down by 1 point or 2 points. So that is what is the efficiency that we need to achieve. And that means that our activities and the processes that have been put into the system has helped to bring in that efficiency. It might be that the doctors are more responsive to the clients, the hospital beds are filled. There are people who are able to come to the hospital. There is more, lesser home deliveries. So there are different things that could have happened, and that tells us the program has been efficient. Very often than not, we might have programs which may not be relevant. To tell you a small example, if you are doing a program which is on, say, for example, poverty elevation or like skill development. Now, and in the skill development, I get a training on AI in a place where people will not get jobs on AI. They have to move out and they have to go searching for jobs and they don't know whether they'll get it or not. So it may not be relevant for them at this point of the thing till the job market is created or they have a linkage to the job market. So our programs, we have to decide whether they are relevant. And these are the four major criteria for evaluation that we really look at. And the last one is your sustainability. The sustainability becomes very important because once the funding is gone, how do you keep it? It's not like setting up a training center for 3 years, and after 3 years they don't have the money. They don't have flow of, there's a problem of cash flow for that program. Then it does not become sustainable. So during the whole process, from the point where the program has been framed to the end of the program, there should be a sustainability plan, and that sustainability plan will ensure that the program continues even if the funding has moved or you have found another funder. The whole cycle of funding starts with the process of planning. So here you have this whole thing. You start estimating what is the impact, and that gets done when the initial process where the due diligence of the funder is being done, or when the baseline studies are done, so that we know, or you're looking at the literature review to see whether this is a problem in that given community. Once that is done, you build a plan, a strategy. This is your part of your program management, where they built a program strategy. And as this program strategy gets done, along with that, ideally, when they do the log frame, the monitoring plan also happens, the evaluation plan also happens. And that will tell you whether we are really being able to provide a social value for the money that is invested. So when we look at evaluation, as I told you, there's a component of program implementation or program management, wherein from the log frame that we have developed, we have, before the log frame is developed, we have a theory of change. The theory of change is basically, I'll explain to you in detail in the next few slides. Just understand that we have to have a thesis for the investment and the change that we are going to get. Then we develop a logic frame model, and then we also list out the indicators. This is all done within the whole concept of the program implementation plan. Once we have this framework, then we decide what is this that we want to measure. We decide whether it's a monitoring, it's a evaluation, and we also list how will we do the methods, whether we'll use qualitative measures, will we use quantitative measures, or will we use mixed methods. I'll come to these details a little later. And then there's also the methodology that we'll follow, whether there's a sampling that needs to be done. We can't go and reach out to, if the project is reaching out to some 50 lakhs people, 50,000 people, we can't reach 50,000 because the budget is going to be very high. So we'll take a sample. So there's a sampling strategy that we'll develop. We'll also design how we want to study, whether it's quality, are we using RCT? Are we using a qualitative sampling strategy, or are we using different tools? And there is what are the tools that we are going to use? What is the measures that we are going to use? And then we will be training we'll identify who's the team that will go and do the evaluation, and then do the data collection, develop the timelines for it, and finally the analysis and the report. So to do all this, before the impact assessment is done, normally we develop an impact assessment protocol that will describe the whole end-to-end strategy, so that we know every person in the chain understands the whole process in the same way and it flows in a smooth manner. So the process once we have understood what we have to do, now we come to the specifics of the impact evaluation. The first thing that we have to understand is that we need to know what is the objective of doing it. And when we are looking at the objectives, we need to go back to the program documents, because they would have a log frame, or they would have a proposal that they have given to the investor. So from that, we arrive at what is that they have expected to achieve, which would probably be in the expected outcomes, or it might be in the objectives that are written for the project, and in the goals that are framed for the project. Once those are done, then you look at you start developing the tools and the data collection. So the data collection process is quite a major part of the thing. And if the tools are not developed properly, you might not get the right data. So I'll come to the tools a little later. What there are standardized and there are customized tools that you develop. So I'll come to that a little later. And then you get into the analysis of the data. So where you see the trends, the patterns, and what is the impact. The most important part, which is often not funded, is the dissemination of the finding. So once you have the results with you, you develop insights. The insight might be that we may have made any changes, or we may not have made any changes. The change might have happened, like if you look at pre-COVID and post-COVID, the insights are very, very different. You will see the insights that we probably made before COVID may not hold true for today. So in essence, when we are doing each of these little tasks that are there, the four major parts of the assessment process, there are little things that we need to understand. When we understand is that we need to know that we are measuring the outcomes. If you are measuring the outputs or you're measuring the process, it might not tell you whether there is a change in the whole program. So the focus is on measuring the outcomes. Because just to give you an example, it might be that I provided computers to a school. But did the computers change the learning of the children? Or you might do orientation. I do this session for you all today. Do I have any outcomes that I've decided for you all? So do I come back and see after one month or 6 months to see, are you all doing the impact assessment properly? That is an outcome. So unless until you have, if you say that I've tick marked my training program today, it might not tell you that the program has made any changes. Even the data that you collect, we need to clean it up and see that the data, the hygiene of the data is managed well. So there is a cleaning process. I suppose people from accounts would know that you still do a data hygiene even for accounts and finances. So that probably is very similar. There are certain ethical standards. There are times when people say, I will go and find out without telling the the non-profit that what you have done. There are certain ethical standards, because it's not fair on the non-profit or on the beneficiary to be asked certain questions when they don't even know what is the purpose of the thing. They don't even know who you are. They don't know whether you're a scam or you're doing something really proper. So there are certain ethical standards that we need to follow. And when we come to analysis, we should be aware that there is a difference between causality and correlation. In causality, we say that the root of it is a root cause is you are aware of, or a mid-level cause is you are able to understand. Or correlation is like this, that there is a rain falling here and there is something growing here, because they may not be related also at times, just they are happening together. One of the most important thing is that when you decide the whole research, are you looking at attribution or contribution? Attribution is that whatever change that has happened, we can mark it out and say this is because of this NGO. Like say, for example, the HIV problem that is in the country. If you look at when interventions were done, you know that today if HIV has remained at 1% in the country, it's because the non-profits have done a robust program with the high-risk group. And that is for, we can say that, yes, we can attribute it to the program that was done by the non-profits. contribution might be that you have opened up schools in the area, and so children of sex workers, people at risk have gone to the school. So it has contributed to get a better information, or you have just given them some campaigns or messages that have been done, and it has contributed. It's not really, you cannot say that that training program really changed anything in that space. So when I spoke to you about theory of change, for any program to happen, we need to have a theory of change. When we say theory of change, it's that it's like drawing roads to a certain point. Like suppose I say that there is all of us have to meet at the secretariat. So then all the roads have to meet to that secretariat. People might take a car, they can take an aeroplane, they can take a two-wheeler. There are different ways in which the causal pathways might be there. But the ultimate, do these pathways really land us into the secretariat office? Correct? So if a change that we are looking at is reducing school dropouts. So do our actions really contribute to reducing school dropouts? Like say, for example, we know that direct cash transfer will improve school attendance. But just registration in the school may not make children really be at the school all the 200 days of school days. 250 school days. So there is a difference, and we have to really draw the pathways so that we know clearly that this is going to make a change and we are able to achieve the target that we have set. So it's most often they're not given as a visual diagram. It tells us how we are making that change, what are the assumptions that we are making, what are the risks that are there, and we are also able to map what is the input that we need, what are the activities that we need to make, what are the outputs that we have. Like say, for example, we have to have a campaign, one campaign. We have to have two trainings in the year. We have to have books and pencils, pens given. We have to ensure that there is a parent meeting that is held. There is a children's meeting to be held. So we know all what has to be, what are the activities and the outputs of the activities, so that we achieve the outcomes that we are saying. And remember, all of these are interconnected. So in the theory of change, we also make out what are the interdependencies between them, so that we get the ultimate impact of improving the literacy in the young children. So I told you that we also look at the risk, because many a time the risk, like say, for example, a lot of the non-profits got money during COVID, before COVID. But the risk had not been, nobody thought that COVID will come in and we would have that such bigger risk. But we do put some risks that are expected in the process. And there's a risk mitigation plan also that is worked out at the non-profit, so that they know that this risk mitigation will keep the risks to the bare minimum. And at the same time, there might be some risks that you may not have a control. Like if tomorrow if a war sets in, we don't have any system that we can put in to ensure that these risks cannot happen. We also work out what are the preconditions. Like say, for example, if I have to enter the school, there is a government order that has to come in and to get access to the school. So these are preconditions. And so we we ensure that these preconditions are listed out, because if the precondition is not met, you don't get access to the community, you're not able to run the program. So the non-profit knows exactly what are the things that they have to do. And most often than not, we try to do this even before the grant, at least in the initial first month of the project. So the theory of change should be clearly articulated. It should be plausible. It should have the validity, because if you do it here or you do it in some other place, it will give us the same results today, tomorrow, day after. It should be testable. You have to have it tested, because it should be based on theoretical framework. It should be based on your baseline. It should be based on community's acceptance, because can it be tested in the field and say that, yes, it will be done? So there is generally a pre-testing, or you take the lessons from other projects or in the same area. Let's try out and do it. And it should be owned by the community. And it should be understood by even a last rung of the staff. Because if they don't understand the theory of change, then they don't know why they're doing the program. And that's why when you do proposal development, at least from my side, I ensure that the program team is also involved so that they understand what is happening, what is conceptualized, and they are able to implement. We also look at, there are principles that are followed in the theory of change. Like the principle might be that, as I told you, one principle is that it should be owned and participation should be there. There should be various stakeholders, involvement of the stakeholders. And we also put the hypothesis, like if you do this, then what will happen? So that sort of a hypothesis there, and we build the strategy around it, as I already mentioned. I'm giving you a small example of the theory of change and how this was done by another project. So we are looking at improving the life chances of the young people through theater. You're using theater as a forum. So the statement that we would have is that young offenders do not have opportunities to engage with drama as a means to improve their skills, because theater is a point where people can talk and they can present themselves. So you're using theater to improve their life skills, and in the local area this sort of a program is not there. So what are the activities that we will be putting? We'll have drama workshop which targets the youth. Then we'll have mentoring programs so that they can hold and they can be supported. We what would we have as outputs is that one workshop is done, and there is also a production team that has that is there, and the production team has put up something as a script or whatever, and there are beneficiary also have done an evaluation of what is happening, and there's one mentoring session per week. Now in the short term, there's a greater sense of routine for the beneficiaries. They have fewer exclusions. Very few people move. Maximum number of people come for the program and minimum are absent for the program. Then you have medium term, which is there is a greater self-confidence that they have developed, they have greater empathy, and on the long term that they are able to re-engage with the formal educational system. The assumption that we have is that drama workshops will contribute to development of self-esteem. People will be able to re-engage because they have attended the drama workshop, and some of the issues that they have as myths and conceptions are addressed through the drama workshop, and exclusion will lead to successful mentoring of the program. So what do we need to have as areas of development? The areas of development might be having a rigorous evidence base, like your monitoring system is well, you have a well-established recording and report maintenance. Then you have your quarterly or 6 monthly mentoring session or your monthly mentoring sessions. And so those sort of things is what we will add in the theory of change. Theory of change for every project may not be the same, or every investor might have different frameworks. I just gave you one example. This is a simpler one. Now I'll show you a more complicated one, which is, yeah. So then we look at, I told you the second one, once a theory of change is done, we do the logic model. The logic model will give, again, is a graphical presentation, which illustrates the association between programmed resources, activities, and the intended outcome. So as a visual representation, what we did in the theory of change as inputs activities gets now more crystallized into this framework. From the theory of change, you remove and put it into the logic frame, and so that the flow can tell you how everything of the resources, the activities, the outcomes, the timelines, the person who is responsible, everything gets captured within the logic model. This will help the staff to guide in their thinking, will also help evaluators in how to evaluate. You know, what were the assumptions that they made? What are the potential challenges that they may face? What were the outcomes that they had thought? It also helps you who are the people that you really need to meet, because it would be given in the logic model. So this is the framework of a logic model. So the logic model, as I told you, will have inputs, activities, output, outcomes, and the goal to be achieved. That is from the project, from the theory of change, you have drawn this out. Now, when we have done that, so it assumes that if you have the resources which come in as inputs, and you do the activity, do the things that we have listed out in the activities, you will generate some outputs that will give you outcomes. The outcomes can be in the short term, mid-term, or long term, and that would help us to achieve the goal. Now, when we are doing the impact, one important thing that we have to remember is that some changes will happen irrespective of whether there's an intervention or not. The project cannot take the credit for what would have happened if it was a natural course. So that's why many a times we suggest that you should have an experimental design. So you compare this project area with another project area where there is no intervention, but there are other issues of ethics, like how can you go and assess somebody without doing anything. So you minus that whole thing from what would have happened naturally, so that we know what is the impact that has happened. So this is a small example of an logic model that is there. So if you look at it, we need what would go as inputs is that you'll have funding, you'll have staff, you know who are the people that we need to partner with. Those are the input. We have to get partners into the process. You might need facilities like a home or a office or whatever the facilities that you require, and you need to have the evaluation specialist. Then the activities might include, like, you have to train the staff, you have to recruit youngsters in the youth, provide counseling services, training programs for the youth. And in that process, the outputs we measure the outputs mostly in either in qualitative or quantitative ways. You might say that we trained 200 people in this training that we are doing. Or they might have been, then you have some few people who would be your trainers of trainers, and they would have gone and trained somebody else. You have recruited some people as trainers of trainers, and then you have run so many counseling sessions, so many workshops, so many one-to-one meetings. You have made so many home visits, you have distributed so many books. All those will come into your outputs. Now, what we look at outcomes is that how do we, like, the outcomes are related to what did I say? If you look at it in the earlier part, we said that outputs are linked to where the outputs here, results. They are linked to efficiency and effectiveness, correct? So if you have to look at it in that sense, we say that the objectives would come in here. So you look at, there are improved levels of self-confidence. They are more empathetic. Sorry, 1 minute. So we look at it in terms of they know about the college application processes. We also know that what are the aspirations of the colleges. So we have some amount of outcome, and we assume that children from the low income group attend the school, or they're preparing to take the exams. And on the long term, we know that we have low income students graduating from high school or college. Yeah. So that is the impact that we have. So when we do this log frame, we come to a point where we'll have certain questions to know whether the impact is got, because you have seen the log frame, you have seen the theory of change, you have understood the logical framework, and you have read the project documents. Now you know what are the questions that I need to ask. The next thing is that what are the questions that I need to find out answers for. So what progress have we made to achieve the intended impact of the project purported to have? Is there an evidence the project is contributing to impact? Sometimes, as I told you, it can be a natural process. Now, what is it that the project program has done to really bring about this change? Are there any other programs that are there which are actually enhancing or distracting the possible impact? Like, say, for example, there is a quarry in the neighborhood of that school. So that quarry might be an income generation program, but it is removing the children and putting them into the quarry. So there are other programs that might be detracking. And has the project really looked at it and seen that? How do you really improve that? Are there any we have intended result, but there are also unintended results that can happen. The unintended result might be that if you are sending children to school, because you're not involved in the familial business, the child might have lost skills of working on the family business, and they might go. That's a current problem that we see. Every child has gone into the school, but they're not interested in working in the farm spaces. So these are the unintended consequences of any program. And so we need to be aware of and see how do we really balance this. Has the program produced any unanticipated impacts? Like the unanticipated impact, you may not have planned it in the beginning, but it happened. Like say, for example, the Kirana shop, the digital payments, it actually has reduced the incomes of the sweet shop. This is an unanticipated impact of a digital payment. Nobody would have expected that the chocolate industry would be affected because the digital payments came in. So now when we know what are the questions, now how do you measure them? So you need to have indicators or matrices to measure them. So when you have, so for each project, based on what is put in the project document, we try to find out what is it that indicators will work for the objectives and the activities based on the theory of change and the logic model. So that, and it also matches with the whole thing. Like suppose I want to understand that children being retained in school is our objective. What will we understand? It probably is that children have come and answered their exam. Might be one good way to measure, or it might be that classroom attendance. That might be another good measure. It might be in terms of children having used uniforms, might be another measure. Children have learned what is cleanliness. That tells you that they are regular at school. So it might be any other matrices that are aware that you can think of based on the objectives and the activities. Now, when we build object indicators, we must remember the word SMART. SMART means that they are specific to the project. It's not something out of the blue that you come and get it. It has to be very specific. It should be measurable. If there's no measuring ability, like you say, people will say that I should be happy. Happiness is my thing. How am I going to measure happiness? For everybody, happiness is very different. So how do we really make it measurable? Is it achievable? Suppose I say that rains are going to come because I've planted 100 trees. Is it achievable? No. We might have only 100 trees. We may not have rains. So we have to be very specific when our indicators are there. We cannot go and measure the rains of the village. They should be relevant to the project. It should not be irrelevant, like something which is not connected, which will not change. So the person who's developing the social impact questionnaire should be aware that what is relevant, and it should be achievable within the small time frame that is there, because most often they're not. Impact assessments are cross-section. Now, when we say measures, there are different types of measures that we have. We might have standard measures. Very often they're not. Like if you're an academic setup or you're a big donor, people want to do comparisons. They want to know whether I've given money to Anita, I've given money to Angela, I've given money to Krishna. Now, can I compare all these three projects together? So I use standard measures so that each of them are comparable. In many of times, most of the projects develop their own measures because they know what they have put it in the project, and they may not be customized matrices. So they will use customized matrices and then make an evaluation on the project. Sometimes there is a group of matrices that we can use, like I might use for solar systems. So I may say that energy efficiency, technology use, number of houses that are electrified. There are different sets that might be there, might be financial. So different things, program management. So all these things might be done in by developing a set of matrices. Now, when we are doing the questionnaires, we also decide whether we want quantitative or qualitative. Generally, like finance and all can be done quantitative because it's easy, the money numbers are there. A lot of the non-profit projects cannot be available for quantitative assessments unless until the training or life skills training that you have done. But if you want to have softer area, did they build their confidence? Did they understand that they can go all alone to the market space? Are they able to go and do the women have access to the market area? So all these are very softer sort of a thing. You may not be able to measure. So you might capture them through qualitative variables. So basically in qualitative variables, you look at qualities, characteristics, experiences, and behaviors, voices of the people. In quantitative, we usually use surveys and structured or semi-structured interview formats. In qualitative, we use IDIs, focus group discussion, key informant interviews, and in a few places, you might use participatory observations. Now, I told you there are choice of matrices, standardized matrices. Like if you look at financial KPIs, you might have return on investment, or cost per outcome. There are various financial KPIs that you can have. Or it can be in terms of operational efficiency, where you're looking at, is it efficiency, is the cost per beneficiary managed? There might be standard matrices, which like the Sustainable Development Goals has a whole indicator list. You have newer ones that are coming up. There's a global, I'm speaking about the global ones now, which is the iris, which is just being in development, and people are trying, working on that, which will tell you whether the impact investing is really giving us results. There are people who are looking at the sustainable, which is already there in the country, the global reporting instrument. You also have for the community interventions, you have the Guide Star, the Robin Hood. So there are various standardized matrices that have been, which are in creation and as well as created. Some of them might be sector specific, which like Government of India will say that maternal mortality, they would have the annual evaluation for a sample people, where they do the SRHR evaluations, or they might have the annual sense, the once in 10 years census, which will have to be very specific to population. Or out. Now, when we come to evaluations, evaluations are of different types. The formative evaluation is the one that you do at the beginning of a project. It is like, it tells you how to formulate your, how to develop your whole concept and help you work on giving the shape and form to the whole project. So that is a formative evaluation. The process evaluation happens on what are the activities that are run by the project. So generally, process evaluation happens in between the project, during the process of the project, where I need to know whether, we say, if a certain process is right, then you're more likely to get the results. So we map the processes and then see whether each of these processes are happening in the right way. And that is called as process evaluation. The outcome is primarily because of the impact. Like outcome, if you want to look at, say, for example, I like to give the example of HIV/AIDS, because in all the HIV/AIDS program, we work on the STIs. We don't work on HIV. So our outcome that we look at is that how many STIs have come down in the certain place, because that is easy to measure, because we have the data, we have the STI clinics that will give us. But we may not have information on how many people have really got HIV, because people may or may not come for testing. The impact is that we keep people of HIV, and that is what is our impact. That's a larger impact. Or even include, like if you're looking at it in maternal deaths also, we want people, healthy babies, healthy mothers. That's your impact. But what we look at in the immediate point is that, do mothers have any infection? Do deaths of the mothers happen? Are mothers dying out of suicide? So we look at it, that is the outcome. So there's a difference between outcome and impact. And finally, one is that the summative evaluation, where we just summarize whatever that is there, whatever the essence and substance of the whole program. We summate it more as a case study or a discussion sort of a thing, so that we are able to get a certain evaluation of the process. Now we have also quantitative designs. There are designs that I told you. So social return on investment, not on evaluation. Sorry, it's a mistake. Uh, Social return on investment is a way wherein we look at whether a certain amount of money that is given will actually give us a social return. And there is a methodology for it. And based on the methodology, it's more an economic evaluation that we do. The other one can be that we have randomized control, like the project that I was working on. We had two projects. One was for maternal infant mortality, and the other one was for education. So we compared these two interventions, and they were assigned randomly to the evaluation, and we followed them up prospectively for the next 3 years of our project to see whether we actually made a change. Or so that is, and we assign people for the study without really them knowing. We randomly assign, and we give them the intervention, or we don't give them an intervention, so that we know that it is a controlled sort of a trial. Like in India, there are JPAL does a lot of RCTs. Then you have experimental and quasi-experimental designs, wherein you take one, you say that I will teach this children English, and I will put you make it into two groups. One group gets English training, one group is without English training, and then we work out and see whether the non-English input children in government schools have improved scores or improved thing compared to those who have no English training. So that's an experimental design, and then it is like a very structured sort of a thing, and then we work it out. The last one is the results-based evaluation or the objective-based evaluation, where we look at our primary focus is on the result, and the whole evaluation starts not from the objective, but from the results. And then we see what made these results happen. We go backwards from there, we see a result, and then we go backwards into the whole design. In the qualitative designs, we have the narrative research, which is your storytelling. Like you might have more significant case method, wherein we look at it as a storyline and what are the changes, and work out on how do we really uh, give that whole case and understanding. And through that case, we really evaluate the whole program and understand where the change process have happened and what really brought out a change. Like we were working on projects on livelihood. And this livelihood project was with the women who were rescued from trafficking. And when we are looking at, we realize that when we are doing the case study, the most significant case study design, we realize that for people to really know that they have changed in their lives was not in terms of whether they did a job or did they earn the money, but how they brought about a change in their own lifestyle. Like were they able to save money? Did their way of dressing change? Did the way their body language change? Did they do things that was different? So in the narrative, we find some threads and thing to understand that the impact of this program is not in that final thing of money, but in the way people change themselves. The stories tell you a lot of things which you probably will not get an understanding on. Then the other one is on the grounded theory, where you build up, you don't have a theory. From your study that you do, you make a theoretical assumption at the end saying that this is what is it that really brought about a change. So there are certain ways wherein you do your qualitative study, and then you look at what are the theoretical frameworks that are coming in, and then based on that you build a whole theory around it. Phenomenology is primarily based on your symptoms and symptoms, wherein, say, for example, we are looking at a cluster fever. And so the patterns of fever in the village might be very different. So then you look at what are the symptoms, what are the characteristics, and then probably come to a point that you can say, okay, we can name this. These were the patterns that we got in terms of symptom, and these patterns fit into something else. And so we can name it is this cluster is what is happening. So we are seeing more of chikungunya here because the patterns that we get as symptoms all fit into the concept of chikungunya. So that is phenomenological. Participatory action research is that where the participants become players in the data collection, in the conceptualization, in every phase of your evaluation. Like we have conducted evaluation wherein we have the community who becomes partners in our evaluation. They help us formulate the questionnaires. They help us formulate the analysis. They help us interpret what the findings are. They give us the insight. They are there from beginning to the end. Or you a little more revised form might be that we give them some tools and we take answers for them. So the level of participation might differ from point to point. So as I said, when there are results, they might be direct in changes, or they might be indirect changes that you see. They can be positive, or they can be negative, or they can be no impact at all. Sometimes it might so happen that what we are seeing may not be what the impact has really said. So it might mean that we may not have enough information. So we don't know much about it. Like as I told you, there's a new fever in the village. And if that new fever it doesn't fit into the existing fevers that we know of, like COVID, when COVID was happening, people did not know what it was. So we needed more knowledge. And collecting more knowledge might be a part of our own evaluation that we do. Once all our data is received, we will have to put it together and then make it in a report form. And when we do the whole report form, there are certain dashboards we do a framework on what it is. We do an analysis plan, we do an interpretation plan, we draw out insights and then synthesize the findings so that we get to a certain framework that we can say that this is how it is. So when we do that, we look at whether most often than not, the way we do it in evaluation, and just put in some of the important things, that are people happy, are satisfied with what the intervention was, and do we have any learnings from it? How do we know that people are they using? They might say that they are satisfied, but they may not really use the services. So are they adopting to what is said in the whole process? Or are we having, are they utilizing the services? Like it can be that the hospital, you have built a new hospital in the area, but are people utilizing it? If the utilization is there, is it efficient? Are the doctors coming into the center? If the doctors are not coming, it is not efficient. If there are no patients coming in, it is not efficient. Is it cost effective? Do people find it useful enough in terms of the cost? Are they aligned to what is the business model as well as aligned to the cultural context of the people? So we need to know whether these are relative to the investment that we have done. Have we attained what we have really defined by client objectives? Many a time, our end user desires may not be really fulfilled. So are we matching the requirements of the clientele? The next one, is it a contribution or an attribution? We need to know whether they are just contributing or they are really, you can say that these results are by the NGO. And we also need to look at the feedbacks that are coming in from different spaces. We also look at how is the activity really run? Are there any lessons? Is there anything that the activity could have been done in this way or that way, or the current way of in which the activities are done? Is it good enough? Are there individual performances that we need to look at? We look at individual performance of the cluster of people who are there, of the staff, of certain categories of people, and is it ultimately giving a organizational performance? Once the whole thing is done, then we'll probably put it as a report as well as a dashboard. Then nowadays, a lot of people want to put their findings as a dashboard on their website or wherever they want to do, because even when we present to our people, we put it on a dashboard so that they are able to see and clearly understand what the patterns are. As I told you, there are certain ethics in evaluation. The primary focus has to be that we do not do any harm to anybody in the process, especially our client base or our beneficiary base, because any harm to them is a harm which will really create problems in the future for that person, and for they may not even come and seek services. Like a badly done evaluation can mean that they lose the trust and confidence of the non-profit that is there. You need to take informed consent. You should never go and ask data from people without asking them, do you consent to being part of the study? If they say that they are not consenting, then we should not. For evaluations, you have a consent form that we develop, and we give it to people. We discuss it with a person who's there from whom you are collecting the data. And once a consent is taken only, then we start talking to them. Maintaining confidentiality is also important, because nobody wants to give information. Remember that there is a consequence when you many a times come and talk to somebody else, and the consequence we as evaluators do not know. And so we need to keep the confidentiality very high, so that there's no harm that is done for the person intentionally or unintentionally. The next important part is the cultural sensitivity. I am from an upper middle class family. And so when I go down to the village or to a tribal area, there might be certain cultural practices which is very alien to me. Do I blend it out with them without making very critical comments? And understanding the language that I use also influences people who are there. And being whatever we have as finding, also sharing with the community and with the staff at the end of the project, so that they are aware. We are transparent about whatever we have seen, and and taking them into the whole process, because once they are aware, because it's their information that we are collecting. We are not collecting our information. It is they have given the time, they have given the energy, and so it is our responsibility to share our findings with them. So the key takeaways are that you have to ensure that the type of the evaluation that you are doing is specific to the program stage. I told you there are different evaluation that you do based on the stage of the program, and also on the needs of the project. And you need to review documents that are there. Without reviewing the document, you cannot go from what is in your head or in your thought process, or what you think that is right. Because many a times people, when they go for evaluation, they go like a policeman or a CID. That is not the way to go for an evaluation. You need to go in wherein you are. There is a mutual respect, there's a mutual appreciation, and there is a sense of engagement, a feeling that we are there with you, so that they also feel that we are respected, we are available, and they can make themselves available. Or otherwise, you start with a mistrust, and a mistrust is not a good way to do an evaluation. You need to have very good tools for measuring the impact. Badly done evaluation is bad report or a bad finding, because if your tools are not very specific, not very measurable, attainable, the smartness is not there, then the evaluation gets a little screwed up, and you will not get what you want to do. And you might come up saying that they are doing very good work, or you might come up saying that they are doing very bad job. There are impacts that happen. There are impacts which happen in the short term, mid-term, long term. And there are some consequences that are unintended. We need to capture the unintended consequences also. And it's important to take stakeholders along in the whole process, as I told you, because the findings are theirs. It has to be relevant to them, and the findings have to be utilized by them. It is not for finding out faults, it's more for finding out how can we better the program. And that's why utilization of the findings become equally important. So it is not evaluation, when we say, is not about accountability. It is about learning, adaptation, and continuous improvement. Thank you so much. Any questions?
So we'll check for the questions, ma'am. I'll check in case if there is any question, I'll put it on the.
I'm looking at it. As of now, there are no questions. I don't see any questions.
Just give me a second. We'll be checking in case if there is any question available on board. As of now, there are no questions, ma'am. So
Yeah,
we checked on the board also. So
yeah.
no questions.
So let me just sum it up in that sense that I've given you only a tip of the iceberg. There are a lot of things that are happening. There's a lot happening at the international level in terms of investor related evaluation and also project related evaluation, because these are two different types of evaluations altogether. And the methodologies also will differ, because I might be the one who's an investor, and the way you'll evaluate my program is very different from what you will evaluate as a NGO related program. So understanding evaluation is something that is there. The second one is that a lot of standardized measures are coming up. As I told you, there's a whole group which is working on the impact measurement, and they're putting up tools and processes. So I think on the long term, we also have to equip ourselves to know what are the tools that are going to come up in the future. Do you all have any questions from? Do you think I should speak about anything? There are two chat questions. Any other questions?
Ma'am, there are certain questions. We are just posting it on the
Group,
link.
is that?
Yeah,
Okay, fine.
just a minute. Ma'am, we have sent it on the group.
I'm trying to open it. It's not open. Can you read it out for me? Because it's taking time. The
Sure,
message
ma'am.
is
Just
not
give me
coming
2 minutes, ma'am.
up.
Ma'am, the first question is auditor and social impact assessor is one and the same person.
Yeah. Under the earlier, they had named it as social auditor, but after a new order, they have changed it as social impact assessor. If you understand the auditor, the role becomes a little different, because you're going an audit. It's more a confirmation of what you're doing. In impact, you're really looking at the impact. So some within the social stock exchange, the concept of social auditor is merged with the social impact auditor. But if you're going on other World Bank project or something like that, the two roles are very different.
Ma'am, the next question is, can you give me an example of narrative research?
Yeah. Narrative research is wherein you collect people's stories. I told you there's a concept called um, uh, uh, most significant case study, wherein we go in the whole process of listening to the stories of the people, and from the listening of the stories of the people, you look at what is the change that has happened in their lives, and based on those stories of where change has happened, you draw out patterns that these are the things that have possibly changed for people. I'll give you an example in terms of nutrition. We know that India is doing a lot for nutrition, and we know that nutrition levels are not coming down. And now, if you have to really understand what are these stories of those people who have improved, there must be some storyline for them, correct? So what you do is that you go into those people, meet those people whose nutrition levels have improved, and ask them to speak about what really made them, what did they do differently, what is their story, what is it that they did differently, what really contributed, so that you have those patterns that are coming in, which will tell you that what will work, what really worked, and how are they different from those people whose nutrition did not change. That is a narrative approach. Have I made it clear? Have you all understood it?
Thanks, ma'am. Next is how to make a social audit report.
See, in the audit report, government has given a format for social impact report, which is your AIR, annual impact report. However, that is a government reporting, but in most of the projects, organizations have a separate, like suppose you're going for a CSR project evaluation, they have a specific impact evaluation report wherein there is a certain framework. If you go to Google and say that a framework for a social impact report, you'll get. But if you're under the social stock exchange, there is a government given report. And that is a framework that we'll use. Every donor has, most donors, big donors have their own formats. And we'll have to follow the formats that are given by the donor. If it is not there, then you just go to the net, search for a standard template, whichever you want, whichever you think is right, and then write the report accordingly. Some of the robust ones are like the ones that are given by USA. Some of the ones that are given by EU, OECD. Those are more robust in when you do the report. Remember, the report flows on from your conceptualization, which is your protocol. Your protocol, when you're developing the protocol for the assessment, it lays down what is it that you're going and that, how you're going to do it, and that gets reflected into the final report. So it's
Ma'am,
all a chain. It's a chain of everything.
Ma'am, the next question is the established standard matrix preferred over custom metrics?
See, the standardized metrics is preferred when there are big donors like Omidyar. If you're using them, they will go for a standardized metrics. If you're going to a UN organization, they would prefer a standardized matrix. Whereas if you're looking at smaller donors, which are like giving for certain things, who are more socially sensitive, then they probably will say they'll go for a customized reporting. So it all depends on organization to organization.
Next question says, ma'am, how to go about with the evaluation when the project does not have the defined theory of chain or log frame or outcome maps?
So yeah, so what I normally do is that as part of the evaluation, I develop it along as part of the evaluation. So I give them the exercises so that we are able to conceptualize it with the staff, develop each of them. I spend about a day for that so that we know what is it, and then use that framework as you go on the evaluation. So we normally do is that once we have got into a contract, we spend a day or two with the staff, develop the conceptualization, and then after, based on that, we develop the tools, and then we do the evaluation.
Next question says, ma'am, how long typically does a social impact assessment take for large single project? Can a single person handle the entire project or is a team required?
Yeah. See, under the social stock exchange, the NGO fills the AIR. The auditor, the impact assessor validates the process. So it's only a matter of validation and depends on what is your sample size. What is it that you have said in the protocol that you're going to do? And based on that, you develop it. If you're looking at other projects, like I have done UN projects, they give you almost 3 to 6 months to do an evaluation because it's in across the whole country. You've got to go to multiple sites, talk to them, then you have to do the analysis. Remember, the qualitative analysis is very, very time consuming. The quantitative is much more simpler because you just feed it into the package and then you get an output. Qualitative means every report has to be transcribed, and then after that you have to do the analysis and then you get the finding. So that is what happens in the evaluation. So it is time consuming. It all depends on what is the funding that is available. I know some organization which spend only 50,000, so and they want you to do it in 15 days. I don't do those evaluation because I'm not convinced that that is an evaluation in that whole sense. But I know that there are people who do it. There are people who take almost 6 months or 8 months to do an evaluation. That's another nothing. In an average, people take anywhere between 2 to 3 months to do an evaluation of the project. And because that's what the money will allow them. Like if you're doing an RCT, the one that I was involved in, that is a 5-year project. So your intervention and the RCT happens side by side. And then we say that the results actually contribute to the change that is happened. So there are various, it all depends on your methodologies that you have used. But I'm saying for the social stock exchange, it is very, very simple.
Next question is, ma'am, how much percentage of project funds can be spent for the impact assessment of the NGO framework?
That is decided by the investor and the NGO who is there. Because there will be a funding that is, there's a budget line. The budget will tell you how much money is parked for the assessment. There's no hard and fast rule.
Next is, wherefore I can get access to reports bank. This will help in prepare reports bank. They are asking. This will help in preparing a qualitative report. Is there a report bank available?
No, there are no report banks that are available, but there are sites which tell you how to do an evaluation. Like if you go to UN has a space where they have evaluation frameworks and theories, and all the documents are given there. It's called as evaluation something. I forgot the name. So there is something like that. Then you have the impact management and measurement group that is working on. Then you have the OECD evaluation frameworks that are there. Then there are Australian frameworks. So there are different ones. It doesn't have a specific thing. What we normally do is that we go to the USA site or the EU site where they give the evaluation reports online, and you can actually look at that and read it and then work on those. But you may not be able to write such sophisticated reports because your funding might not be available. That's more for learning.
Next question says, are there cases related SOPs available?
Online, you get a lot of SOPs. You just give a fine for evaluation SOP, you'll get. I would suggest the US. I like to go to the USA sites because they're very, very sophisticated and very well done things, or the EU groups which are done. I don't, even in India, you have a evaluation agency forum that has been put by the government. And Niti Aayog has its own evaluation framework. The company secretaries have a framework.
Next question says, is it entirely the judgment of the assessor as to form of evaluation?
No, it is not entirely the role of the uh, social impact assessor. It has to be done based on what is there in the theoretical space, that is your conceptual space of other evidences and researches that are there. It has to go in terms of what is there on the documents that are said. It has to go aligned with what the project has said that they want to do. You need to do a little bit of referencing so that you know that your whole evaluation framework is robust. It's not a one person's job or it's not just what is in my head. When I say that, it's not what I bring from my own space. It has to be agreed on by the investor. It has to be agreed on by the non-profit or the social enterprise.
Ma'am, the next question is, what is the standard sample size to be selected?
If you are looking at quantitative research, you have the sampling formula. So you have to get the total sample size, the whole population that is reached, and using the sample framework that you develop a sampling size. However, money decides what is it that you can do, what is the amount of significance that you really want to do, so the degree of freedom. And so you need to work out all that, because even though I want a very good sample, I may not be able to do because I don't have the money, or I might have so much of money that I might be able to take a bigger sample. Like one of the projects I was asked to do, they wanted me to have such a huge sample, and there are standard costing that we do for the size of the sample. So if I looked at it, I had hardly any money to even look at going and doing the data collection, and I had to refuse them. I said, this funding does not work out for this evaluation, the size of sample that you have given in a dispersed thing, because then I have to fabricate the data. If there's no money, there's only one option. I fabricate the data. I said, I'm not here to fabricate the data. If you give me the money, either you bring down the sample size so that and this sample size is very high, and your statistical sampling does not require so much of sample size. Because then and that's where I said, no, I cannot do it.
Ma'am, the next question is, yeah, sorry, ma'am. Yeah, you were saying something?
Somebody else may have gone and done the study because they don't mind fabricating the data. Yeah, what's the next question?
How to calculate social value in SROI calculation?
See, there's a whole methodology for it, and I will not be able to take it in this session. You need a very separate session because it's a methodology by itself. Because the value creation is based on formulas that you need to apply.
Right. Ma'am, the next question says, can a social impact assessor do the impact assessment of government projects?
See, social impact auditor is for social stock exchange. There is no mandate that they can go and do a government intervention. Government has its own decisions that they do. They might call universities, they might call international institutes, they will give a bid, they will call they might call the big fours, they can call anybody. So social impact auditor as a designation is only meant for the social stock exchange. That's my understanding. I might be wrong. That should be answered by the government, not by me.
So, ma'am, the questions are over now.
Yeah.
Yeah.
Any
So,
other questions they want if they're not satisfied with the answers?
I request members to just post in the questions. In case you need clarification, we can separately discuss with madam and let them know. So as of now, we don't have any questions. So, thank you, madam.
Yeah, thank you
Yeah.
so much. And
Thank
I
you
hope
so much for taking your time out and taking this session. I hope the members are benefited with your knowledge base and as this is a very new concept and we are also learning in this, we need experienced people like you to just enrich our knowledge and enhance our capabilities so that the actual essence of the social impact assessment is achieved by all of us and we together achieve that goal. So on behalf of Institute of Social Auditors of India, thank you so much, Anita ma'am. We look forward for more such sessions with you. Maybe we'll be coming up with some physical sessions and
Yeah,
invite members so that we can have live case studies, you know,
yeah. We can have more practical exercises. That's what I
practical
said,
experience.
that having this is a topic which is like a whole MA course.
Yeah,
Evaluation can be an MA course.
yeah, yeah.
That is the body of knowledge that you have. So in 1.5 hours, you can only give a little droplings here,
Overview.
overview, and probably having a little physical session with a little longer duration might at least give you the basic fundamentals.
Yeah, yeah. So thank you so much, ma'am.
You,
Looking forward for your support in future also.
yeah,
Thanks a lot.
thank you.
Thank you.
So, bye. See you. Bye.